You'll be working with a physical and an occupational therapist at the hospital. I'm Darlene, one of the physical therapists, or PTs, and we'll be teaching you a home exercise program that's been designed for flexibility, strengthening, to start to help you walk and move more normally again. We're also going to make sure that you're safe with mobility activities like walking, getting on and off a bed, a car, and up and down off of furniture to prepare you to go home again. Safety is a big deal to us here at the hospital. We know that patients are at a higher fall risk after surgery, likely than they were before. And this is because of the anesthesia that's working out of your system. You may be on some pain medications that you're not used to. You might be hooked up to some lines like IVs or perhaps a catheter. And we also know that it takes some time for your body just to adapt to the new joint, and your balance might be a little bit off initially. So because of this, we want to make sure that you don't try to get up on your own. You must have a staff member with you whenever you get up to your feet. And once cleared by PT, your care coach can also be that person to give supervision if staff is not in the room. Hand hygiene is also a critical part of your healing. When the care team members come in to work with you, they will have washed their hands. In fact, we like to have you see us doing it as we're walking in the room. And we often will use the dispenser of gel that's right there in your room. We keep a small bottle of the gel, and we also have a sink in the room for caregivers as well as yourself to use. We really stress the importance of good hand hygiene for staff as well as the patient. The day of surgery, we want to make sure that you bring in any items that will help us to care for you better. This can include hearing aids if appropriate, glasses if you wear them, any shoes or special braces that you might normally wear. And we also ask that you bring in a walker if you have one. We're going to talk more about the walker in just a couple of slides. Each patient's going to get a belt like this, and this is something that you'll be able to take home. We're going to be using this on you. We'll have it around you when you're up moving at the hospital because of the safety concerns I just talked about. It's also a good advice or a good assist to help you get your surgical leg on and off the bed if needed. And we'll show you how to do that. The other reason that you might use this is as a tool for exercise. It can help get your range of motion back just by putting it underneath your leg and using it to help your hip and knee joint start to move again. So everyone gets one of these when you go home. I want to talk about pain control now. Most patients, when they're preparing to come in for joint replacement surgery, are naturally concerned about the pain that they're going to experience. And you will have pain after surgery. It will likely be a different sort of pain. Instead of that deep joint pain that you're having now from arthritis, post-op pain is due more from the swelling and stiffness that's related to the surgery itself. And the good news is, unlike the arthritis pain, this pain does improve and it will go away. We use a 0 to 10 pain scale here at the hospital, 0 being no pain and 10 being the worst pain that you can imagine. We expect that your pain level will be higher when you're moving as compared to when you're at rest. And our goal is to have the pain level decrease, the number decrease after movement back closer to where it was at baseline when you were resting. For example, before getting up to walk at rest, you might report your pain to be a 2 out of 10. And then you get up and walk with the nurse or do exercise with your therapist, and we would expect your pain number to increase, maybe let's say a 5 out of 10. Well, within a fairly short time, we'd like that number to get back down closer to what it was at baseline, or a 2 out of 10. Pain management is a very important part of your treatment for a good hospital experience as well as for optimal outcome. We believe it's important to be proactive when managing your pain before it becomes a problem, and we do this in a variety of ways. In surgery, you'll receive a pain cocktail that's injected into the surgical area, and this anesthesia will last for several hours after surgery. We refer to this period of time as a honeymoon period, and we'll talk more about that in just a moment. Other ways that we help you to manage your pain is that PT and OT will always coordinate with the nurses before therapy sessions to make sure that you've had your pain medication. We really encourage you to make sure and take that medicine so that you can comfortably work with a therapist and just to have a good outcome. Other ways that will help you is through ice and elevation, and this will help with swelling, which in turn helps with the pain and your joint mobility. We'll also be teaching you some breathing and relaxation techniques to help you when you hurt. And lastly, we'll make sure to help you avoid overdoing, especially during the honeymoon period. So let's talk more about that honeymoon period. Folks don't stay in the hospital very long these days, maybe 1 to 2 days on average. And as I mentioned, the anesthesia stays in your system for several hours after surgery. It's during this period of time, the honeymoon period, when our patients often report little to no pain and have a tendency to want to overdo. I often hear patients try to convince me that they can walk further the day of surgery, and they tell me things like, honey, you don't know how good it feels to walk when I've had such pain for so long, and finally that bad pain is gone. And while we appreciate the joy and enthusiasm that they have, we also know that their pain is likely to really increase once the anesthesia leaves their system and the honeymoon period is over. So please allow us to help you to progress your activity safely. As the slide shows, walking is very important for our whole body, for our entire well-being. And that's why you're here. You all know it. You're here because you want to be able to walk better. Especially after surgery, walking is crucial. Walking frequently and as soon as safely possible after surgery is so important for preventing blood clots, helping reduce pain and swelling, and just to get your joint moving again. As the top of this slide shows, walking is very important for our whole body, our entire well-being. And you all know it. That's why you're here. You want to be able to walk better. Walking is especially important following surgery. Walking as soon as safely possible after surgery and as frequently as you can is so important for preventing blood clots, for reducing pain and swelling, and to get the joint moving again. Now, depending on the time of your surgery, each patient will be getting up out of bed either with a physical therapist or a nurse. We find that most patients tolerate walking the very same day or evening of their surgery. Studies show, and we certainly see, that patients do better in terms of recovering more quickly and more completely if they're given opportunities to walk frequently while at the hospital and as well as when they first return home. Now, the way this works is you'll be having physical and occupational therapy one time each a day, but in addition to that, you must walk several times a day with the nurses. And these are not scheduled episodes. The way it works is that you initiate calling the nurse on your call button whenever you have to use the bathroom or when you feel up to taking a walk in the room or a short walk in the hallway. It's key to walk frequently and often, or frequently in short distances, I should say. Please don't worry about bothering the nurses. I often hear patients say, well, I didn't want to bother the nurses. They must be so busy. Well, we are busy, they are, but this is what we're here for. And we want you to walk. Each person on your care team really sincerely does care about your outcome, and we want you to have the best hospital experience as possible. So please, please ask us. It's that important. Remember, every walk counts, and it's not the distance, but the frequency and the quality with which you walk. We're going to talk more about quality in just a bit. Yeah, we don't want you to overdo. We wrote up here 100 feet maximum, and what we're talking about is we find that if we limit patients on the day of surgery not to exceed 50 feet at one time as a maximum, and then the following day after surgery and until they're discharged to keep it at 100 feet maximum, they can do that several times a day, but we find that that seems to be a pretty good distance to avoid unnecessary pain when the anesthesia wears off and the honeymoon period is over. So as I mentioned, the therapist and the nursing staff will help you to progress your distance safely, and also we're going to really be focused on the quality of your walking. It's important to walk as normally as you can, but for most of you who have had pain from the arthritis, you've developed some abnormal gait techniques and ways of compensating. Now, we don't expect those habits to go away overnight, but with one-on-one instruction from your therapist and exercises that we'll be teaching you, most of our patients do notice a positive difference right away after surgery in that they can take more weight on their legs and that their walking becomes more normal. Weight bearing is tolerated, or WBAT, just means that you are allowed to put whatever weight you can tolerate on your leg right after surgery. Your joint is designed to bear your weight. Now, that being said, we know that it can be a challenge from the post-op pain, but you cannot do any damage to the joint by putting weight on it. In fact, that's what helps to heal it. By putting weight as tolerated through your leg, you're going to help to strengthen and heal the bones and the muscles around your joint. So please, please know that that's good to do and that we'll work with you on whatever weight you can tolerate. Initially, you may need to take more weight on your hands until your leg feels better. So that being said, even though you can bear as much weight as tolerated, each patient will be required to use a walking device. As mentioned earlier, if you have a front-wheeled walker, we ask that you bring that in on the day of surgery. A front-wheel walker looks like this, with wheels just in the front. So if you could have your care coach or family member bring that in with you and bring it to your room once a room has been assigned to you. But please don't worry if you don't have a walker at home. Your physical therapist at the hospital will help you to arrange to get one. And another thing you can do is have your doctor write a prescription for a walker, and you could pick one up before coming in for surgery. But please bring it in so that we can make sure that the height is adjusted and the fit is proper for you. I'd like to show you how to demonstrate that on the walker as far as the proper height. And I'll show you that now. So we want to adjust the walker so that the top of the handpiece of the walker hits right at your wrist when you're standing with your posture normal and your arms extended. So this walker would be a really good height for me. The reason for that is we want to have a little bend in your elbow when you go to use the walker, and that will help you the most for balance and for being able to bear some of the weight through your arms as needed. So most patients, the majority of patients, will use a front wheel walker after surgery initially. If you have a preference for a different type of device, please talk to your therapist about that at the hospital, and between they and you, they can help you determine the optimal device for you. Generally speaking, most of the patients use an assisted device for 4 weeks following surgery. And the reason for that is not only for safety, but also to give adequate time for getting your legs stronger and more flexible and improving your balance so that you can have the most normal walk as possible. What we don't want to see is you go back to doing your old habits of limping or having to hold on to walls or furniture for support just because you got rid of the walker a little bit sooner than you maybe should have. So allow your physical therapist to help you determine when the right time is not to need to use it anymore. That will be your therapist that can help you with that at the hospital in talking you through that, or if you have follow-up therapy afterwards, then they can help you to determine when you no longer need to use the walker. Speaking of follow-up therapy, our total knee patients will all be having follow-up therapy when they leave the hospital, either at home with home health or as an outpatient. Our total hip patients generally do not require the follow-up therapy as it is not indicated with hip replacement surgery usually. Now, as far as stairs go, we're not going to get into any details here because really a lot of the technique that the therapist shows will depend on your mobility level as well as what your home environment is like. Some people have no rails at home on front steps. Some people have one rail. There are two-story homes, single-story homes. So you'll talk to your therapist about what your environment is, and then the therapist will teach you and your care coach safe methods for going up and down that really pertain to you. So remember to have your care coach there at the hospital 9 o'clock the morning after surgery, because that's when the care team members will start to schedule their training sessions with you both. Now that being said, most patients can do stairs when they go home, but it's really not a bad idea to have everything on one level if you can do that at your home so that you don't have to go up and down stairs. It probably will be easier on you if you can make everything be on the main level and have a bed down there initially until you feel more up to doing stairs. So we'll touch on car transfers real briefly here. And again, we won't get into any specific details. You'll talk about that with your therapist more when you come to the hospital. But generally speaking, it's a good idea to bring a vehicle in to be transported home in that's not too tall nor one that's too short, just for ease of getting in and out. And you've all had pain for quite a while. You probably have techniques that work well for you, but your therapist might be able to teach you or verbalize a few techniques that could make life easier for you. And you may have some post-surgical guide or precautions depending on your particular surgeon and your particular surgery that the therapist might have to show you some modified techniques. But again, we'll do that when you come to the hospital. The last slide that I'll be sharing with you today is about exercise. And yes, there will be exercises after surgery. And we're going to talk about how it's even important to do before surgery. Today, you're getting a packet with your materials, and it has a book that looks like this. On page 17, you'll find a section on pre-op exercises. And we recommend that you do those ahead of time. That's why we were giving you the book today. We'd like you to do those so that you can prepare your muscles and also just to be able to let your body become familiar with the exercises to make it easier for you after surgery. There's something called muscle memory, which just means that if you could perform these before surgery, then your body will remember how to do them better with repetition. We'll remember how to do them better when you're coming off anesthesia and maybe feeling a little bit overwhelmed after surgery. It's nice to have this done ahead of time. So get used to these, page 17. One of my colleagues is here, and we're going to demonstrate for you a couple of exercises from your book. Now, we're doing this on a couple of chairs just for demonstration purposes, but we do recommend that you do these on your bed at home. Please don't get down on the floor. For most people, it's too hard to get back up, and really we don't want you crawling on the floor anyway, so just go ahead and do them on your bed at home. And just like we mentioned with the walking, that we want to discourage overdoing, especially during the first few days after surgery when you're still in the honeymoon period possibly. Same thing with the exercise. We've listed how many repetitions we recommend, and we really do ask that you try to stick with what's been written down. Sometimes people get a little rambunctious and energetic, and then they end up having more inflammation. Sometimes they develop tendinitis because they kind of did too much. So just stick to what we wrote in the book, and we'll be fine. We ask that you do these exercises 2 to 3 times a day. They focus on flexibility, which will help with getting your knee joint or your hip joint to move better so that you can walk again. And then the strength part kind of comes a little bit later. But we'd like to demonstrate with Jenny here. The first exercise says ankle pumps. And you're just going to pump your feet up and down. This will help with blood clots, and really nice to stretch out the Achilles tendon so that when you do walk, you'll be able to get your heel down nicely on the floor like normal walking. So up and down. With all these exercises, we just do them to the point of your pain tolerance. And we know that there is some pain after surgery, but there's a difference between stretching and then excruciating pain. And we certainly do not ask that you push it so hard that you're in a lot of pain. She should feel more like a gentle stretch. The next exercise is called a quadricep or a quad set. And this is an isometric where Jenny's just going to push her knees down into the chair, both sides, and she's tightening up the muscles in her thigh or the quads, holding for about 3 seconds, just enough to kind of fire those muscles and retrain them to help with walking. So she holds for 3 seconds, and in the book it'll say to repeat those 10 or 15 times. The next exercise is a heel slide, and Jenny's going to slide her heel up toward her bottom as far as she comfortably can, and then back down again. So whether you have a hip or a knee replacement, these are an example of 3 of the exercises that you'll be asked to do. And again, try to do some before surgery so that you'll become familiar with them, and that will help for afterwards when we do these again with you. Now, after surgery, when you're at the hospital, you'll be working out of page 29 in the post-op section part of your book. So again, bring it with you, and then we can go over each exercise with you after surgery, with you and your care coach. The therapist will show you and your care coach proper technique, and we'll also stress again how important it is not to overdo. Just like with the walking, it's super important to do your exercises to help with the swelling and to get your joint moving again, but we don't want you overdoing so that you pay for it later and then possibly have a setback because you don't want to do the exercise again. We don't want your pain to get out of control. I mentioned the breathing and relaxation techniques that we're going to show you, and we'll definitely be helping you with that as we teach you the exercises. Most of the exercises after surgery, as well as before, are with the emphasis on flexibility. We know that the window of time following surgery is critical to get moving that joint so as to prevent scar tissue. And maybe some of you have had friends who have horror stories, how they never got their range of motion back just because they didn't do the exercises as they were asked to. So yeah, don't shortchange yourself on this. Walking doesn't take the place of exercise, and exercise certainly doesn't take the place of walking. It's all an important part of your rehab. It lists in the book how many times a day to do them and how many repetitions. So please follow the book as it's written. It was intentionally written as it is so that you can do what you need to without overdoing. Well, I think that's about it. I want to thank you all for coming today. I want to thank you for choosing Providence, and we look forward to working with you and your new joint.
Hi, my name's Carol, and I'm an occupational therapist. That's OT for short. We will be seeing you during your hospital stay to help you become independent again in the area called activities of daily living. That includes getting dressed, toileting, and showering. We will also evaluate whether or not you need to purchase any bathroom equipment. We also have assistive devices that you may find beneficial. Okay. Now we're going to talk about dressing. Okay. On your first day after surgery, your occupational therapist will have you dress in your comfortable clothes, shoes, or slippers. We will assess whether or not you will need to use long-handled assistive devices like these. Long-handled shoehorn, reacher, and a sock aid. Okay. If you had a total hip replacement, you may have what's called hip bending precautions. If you have these precautions, rest assured your occupational therapist will be sure and explain it clearly to you, and you will understand what they are. We will give you an opportunity to use the assistive devices so that you can feel comfortable doing your lower body dressing and activities of daily living. In your book, there is a vendor list. It has several places in the Snohomish County area that sell the equipment. You ought to know that majority of the insurance companies will not pay for these kinds of gadgets.
Yeah.
Let's talk a little bit about toileting. Your occupational therapist will also evaluate your ability to get up and down off the toilet. Again, depending on your height and whether or not you have hip bending precautions, we will help assess whether or not you need to purchase a raised toilet seat. And this is an example of what that looks like. From my experience, many patients who have had total knee replacements will likely not need to use a raised toilet seat. Okay, now let's talk a little bit about hygiene. Most of our surgeons will allow you to shower on the second or third day after you get home from the hospital. You will have a water-resistant bandage, and it's best to leave that alone. You should not have to add any more reinforcement or protective covering to that bandage. The OT will also show you safe methods for getting in and out of the bathtub or the shower stall. And at this time, we will also evaluate whether or not you need to purchase bathroom safety equipment, such as a shower chair or a tub bench. So now we're going to talk a little bit about safety in your home. Okay. Here's a list of suggestions for being safe in your home environment. You want to be sure and pick up small throw rugs and keep walking areas well lit and free of clutter and pets. Keep your phone with you. Please don't try and carry items in your hands while you're using your walker. Don't be tempted to set your walker aside when you walk into your kitchen or into the bathroom. Always keep your walker with you. There are also items like walker bags and trays that you can attach to your walker to help you carry items. If you have any therapy-related questions, please jot them down and we will answer them when you're here. Thank you again for choosing Providence, and we look forward to working with you.
We want to thank you for being here, for attending the class. We'd like to thank you for choosing Providence, and we look forward to working with you and your new joint.
On behalf of Providence Rehab Services, we have a song for you. It's a new joint after all. It's a new joint after all. Be careful, people, don't you fall. It's a brand new joint. It's a joint that bends, it's a joint that kicks. It will help you stand, it will help you sit. It will help you move, we are sure of it. It's a new joint after all. Doctor, doctor, he fixed it good. Did just what we knew he would. Now do your rehab, come on dude. It's a brand new, spanking new. It's a brand new joint.
I just was entertained.
Should I say on behalf of Providence Rehab? We have a song for
I
you.
think that would be good.
All
Would
right.
you?
Yeah.
Oh, you want to say it?
Sure.
Okay,
Yeah.
good.
On behalf of Providence Rehab Services, we have a song for you.
It's a
new joint after all. It's a new joint after all. Be careful, people, don't you fall. It's a brand new joint. It's a joint that bends, it's a joint that kicks. It'll help you stand, it will help you sit. It will help you move, we are sure of it. It's a brand new joint after all. Doctor, doctor, he fixed it good. Did just what we knew he would. Now do your rehab, come on dude. It's a brand new joint.
Do that one more time
I
because
think-
she's got it now.
I think we need
She's
to do
got
it
it now.
over again.
Because she's never seen it. Okay, so let me get the
It was really good.
exercises.
It was really nice.
Because when I
But
do,
I
can you
think
go?
one thing I'm gonna do, I'm gonna
exercise?
try something.
So-
Go ahead and pull that mic off.
Oh, good.
Oh, and then you know where it says,
Something different.
you know
Yeah,
where it
go ahead. Let me
says,
have that.
you know where it says, it's a brand new, spanking new, brand new joint.
On the
So at
last
the very
verse?
end,
All
there we
right.
go, it's brand new, because it's like the climax
Okay.
of
Let me
it.
check
And I'll
this.
just lean and go spanking new.
Okay. She's getting feisty now.
No, every time I sing my card, that's what I do, and I go, I'm gonna not be happy if I don't do that. You see what I'm saying? Okay, and here's
Okay.
where I'm gonna say exercise, so it says, come on, do your rehab,
Oh.
dude. Thinking that, I don't know if we're very
It was
clear.
very clear.
Oh, good.
When you're ready.
All right. On behalf of Providence Rehab Services, we have a song for you.
It's
a new joint after all.
You need to start.
I started
at
too
the same
soon.
time, yeah.
Yep, sorry.
Well, one of you could go 1, 2, 3,
Okay.
Good,
Okay,
that's
that's
you.
the way.
Okay, how about if I just go?
from the beginning.
All right. On behalf of Providence Rehab Services, we have a song for you.
It's a new joint. Oh, we didn't do it?
I'll do it. I'll
Okay,
go like
yeah,
that.
that'd be good.
Okay.
All right.
Same thing.
On behalf of Providence Rehab Services, we have a song for you.
It's a new joint after all. It's a new joint after all. Be careful, people, don't you fall. It's a brand new joint. It's a joint that bends, it's a joint that kicks. It will help you stand, it will help you sit. It will help you move, we are sure of it. It's a new joint after all. Doctor, doctor, he fixed it good. Did just what we knew he would. Now do your rehab, come on dude. It's a brand new,
Spanking new.
it's a brand new joint.
Okay, wait.
No, Carol.
You what?
We're
What?
gonna say, and she wrote the
And then I'm
song.
gonna go, oh, psh, and then say, I did write it.
Okay.
Maybe that's just stupid. I don't know, I'm not letting go of this. I'm dead serious. Can you imagine working with me in some of these productions? Oh,
Well, you
God.
never know, there
I
might be
just-
somebody
I
from
want it to be just
Hollywood
like
in there,
I
they
know
need to
that
know
one.
who
Okay.
wrote it.
Real tight.
We're gonna
I
sing
got
it all
you,
over
Mike.
again?
Okay.
No, just the
just
last
that,
part.
okay.
Yeah.
Just what you want to do. But
And she wrote this.
Oh, psh, I did write it.
one more time.
And she wrote that.
Well, we use her name.
Oh, and Darlene.
And Darlene wrote that.
Oh, psh, I did write it.
I like